Valiteq is a convenient system for meeting the requirements of USP Chapter 797 for the verification of aseptic technique for personnel performing serial dilution preparations commonly encountered in allergy and clinical immunology practices. The Valiteq kit contains 2 vials of double-strength tryptic soy broth, complete instructions, and documentation for 2 verification procedures. In order to perform the Valiteq verification, you will need the following materials: 1 3 ml syringe and needle, 1 5 or 10 ml syringe and needle, 1 Valiteq VM10 vial, a labeled empty test vial, sufficient preservative-free sterile water for injection, and individual alcohol swabs. Assemble the required supplies. Complete the information on the Valiteq test vial label and affix the label to an empty, sterile 20 ml or larger vial. Don a clean gown or lab coat, hairnet, and face mask. Prepare the hands. Don gloves. Sanitize a work zone that is free of all paper products, clutter, and away from ventilation systems and personnel traffic. Disinfect the work zone and gloves with a 70% isopropyl alcohol spray and allow them to air dry. If necessary, aseptically assemble the syringes and needles. Remove the flip tops from all vials and wipe each vial septum with a separate alcohol swab to disinfect. Allow the septa to air dry. Using the 3 ml syringe, aseptically remove 0.5 ml from the VM10 vial and transfer it to the empty test vial. Repeat this step 9 more times for a total transfer volume of 5 mLs. Using the 5 or 10 ml syringe, withdraw 5 mLs of sterile water for injection and transfer it to the test vial. Label the partially used VM10 vial with the date and name of the operator. Incubate the test and VM10 vials at room temperature of 20 to 25 degrees centigrade for 14 days. Observe all vials after 24 hours, 72 hours, 1 week, and 2 weeks. If the solution remains clear, record as no growth. A passing result requires that all inspections demonstrate no growth. Any turbidity or sedimentation present in the test and VM10 vials represents a failing result. Fill out the bottom section of the product insert test record form and retain the completed form in the candidate's personnel records as documentation of the test. Repeat the test annually or as necessary to demonstrate the candidate's aseptic technique verification compliance with USP 797. Congratulations on your purchase of the EnviroAssay Environmental Sampling Kit. The EnviroAssay Kit is the direct result of the recent update of USP Standard 797, which includes the new requirement that CSP compounding facilities regularly monitor and act upon the microbial and particulate air quality of their sterile compounding and support environments. The EnviroAssay DPC Kit, which includes a discrete particle counter, or DPC, facilitates active sampling of your controlled environments for both airborne microbial, or aerobiological contaminants, as well as non-viable airborne particulate contamination. It also provides sampling for microbial contamination present on facility environmental surfaces. The EnviroAssay Basic Kit, available without the DPC, facilitates active aerobiological and surface microbial sampling only. Regular routine monitoring of both viable and non-viable contamination will be required by USP 797, along with appropriate corrective action for any out-of-limits condition detected. The performance of any type of quality assurance environmental monitoring requires the proper equipment and careful adherence to strict disciplines in order to produce meaningful results. The EnviroAssay Kit contains the following components with which you should become familiar. A supply of 5 biocassettes containing tryptic soy agar, or TSA, for recovery of airborne bacteria. 5 biocassettes containing malt extract agar, or MEA, for recovery of airborne fungus and molds. 20 surface contact plates for recovery of surface bacteria, a precision adjustable volume air pump for calibrated operation of the biocassettes, and a tripod with adapter for mounting the biocassette during sampling. The contact plates provided with the EnviroAssay Kit are used to recover contamination present on environmental and personnel glove tip surfaces. These plates consist of a delicate, convex protrusion of sterile tryptic soy gelatin-like agar, which is covered with a removable plastic cover. Stage the required number of contact plates for the monitoring task. Number and date each plate covered to identify the sample. Describe and enter each sample number in the sample log. Remove the cover from the contact plate, taking care not to touch the cover interior, or agar medium. Gently, but firmly, apply the agar face to the surface to be sampled and press lightly. Lift the plate from the sampled surface and recover it immediately with the sterile cover. Following sampling, thoroughly clean and disinfect the sample location to prevent contamination by agar residues. Upon completion of sampling, incubate the sample plates at room temperature of 20 to 25 degrees centigrade for a period of 2 weeks. Check the plates for microbial development at 48 hours, 96 hours, and 2 weeks. Count the number of colony-forming units, or CFUs, observed. This is done to assure that overgrowth of potential contaminants will not obscure the true observable number of colony-forming units. Record the results on the sample log following each inspection. Active airborne or aerobiological sampling of your compounding facility and engineering controls is carried out using the revolutionary biocassette. The biocassette is a self-contained sampler and petri dish in one unit. The biocassette is the equivalent of the Anderson N6 single-stage impactor, proven the gold standard of aerobiological sampling. The biocassette facilitates active air sampling without the need for pre-cleaning and sterilizing of the sampler, or any risk of cross-contamination of successive samples. To use the biocassette for aerobiological monitoring of the critical work environment in an LAFW, compounding aseptic isolator, or biosafety cabinet, Begin by attaching the sampling hose to both the biocassette and air pump. Plug in the pump and stage it outside the LAFW in a manner that will allow placement of the biocassette at all desired sample locations. Recommended monitoring of the at-rest LAFW consists of an aggregate of 5 equidistant samples of at least 3 minutes each along the work surface center line, for a total sample of 450 liters of air sampled. An in-process sample of the LAFW will involve placement of the sampler in close proximity to the work zone in at least 2 locations for a total aggregate sample of 450 liters. Place the biocassette at sample location 1 on the LAFW critical work surface. Carefully remove the Valiteq biocassette cover without touching the sampler face, and place the cover in a secure location in first air. You are now ready to begin sampling. Activate the sample by switching on the pump. Adjust the sample volume as necessary by turning the flow adjustment knob to adjust the flow rate to 30 liters per minute. Upon completion of sampling at each location, turn off the pump. Move the biocassette to the next sample location and reactivate the pump to resume sampling. When all locations have been sampled, remove the circular inner protective membrane from the Valiteq cover and aseptically replace the cover on the biocassette, assuring a complete seal. Label the sample. The sample may now either be placed into incubation for the required period of time or sent to the Lab Safety Environmental Monitoring Lab for development. Remember to be mindful of the expiration of the biocassettes and contact plates contained in the EnviroAssay kit, and reorder these perishable items periodically as necessary. Sampling the room environment requires development of a formalized sampling plan, which should include locations, sampling methods, sampling volumes, sampling frequency, the time of day as related to the compounding activity, and action levels. To sample the room environment, assemble the biocassette and pump as previously described. Deploy the tripod and attach the biocassette to the adapter by pressing it into the cross channels in the adapter. The snugness of the biocassette to adapter connection is established by adjusting the small set screws in the adapter in or out. Place the tripod with biocassette at sample location 1. Carefully remove the Valiteq biocassette cover without touching the sampler face, and place the cover in a secure location in first air. You are now ready to begin sampling. Activate the sample by switching on the pump. Adjust the sample volume as necessary by turning the flow adjustment knob to achieve a flow rate of 30 liters per minute. Carefully observe and record all conditions occurring during the sampling period, including personnel present, gowning status, activity levels, and other factors which might bear upon the sampling outcomes. Recommended sampling volumes for room samples are a minimum of 450 liters per sample at each sampling location, with a maximum sample volume of 1 cubic meter per biocassette. Upon completion of sampling at each location, turn off the pump. Remove the circular inner protective membrane from the Valiteq cover and aseptically replace the cover on the biocassette, assuring a complete seal. To continue sampling, proceed to the next location. Replace the biocassette as described and reactivate the pump to resume sampling. When you have completed all sampling with the TSA biocassettes, repeat the process with the MEA biocassettes to assure detection of the full range of potential microorganisms present in the room environment. Be certain to label each biocassette upon completion to avoid mix-ups. Place the biocassette samples into incubation, or send them to the designated environmental monitoring laboratory for development and reporting. If sample development is performed in-house, it is necessary to correct results for coincidence error using the positive hole correction table included with the kit instructions. Proper use of the EnviroAssay environmental sampling kit will assure effective microbial and airborne particle count monitoring of the CSP process and personnel, leading to full compliance with USP Standard 797 and the best possible control of your aseptic compounding environment.